Hello and welcome to my channel. In this channel, we explain various nursing concepts in a simple form for a better and easy understanding. These videos could be used by both LPN and RN students as well as nurses who are trying to refresh their basic concepts. My name is Nasmosh. In this video, we're going to talk about some GI medications, and some of the medications we're going to talk about in this video include histamine 2 receptor antagonists. We're going to talk about PPIs as well as mucosal protectants, antacid, and prostaglandins. So, histamine 2 receptor antagonists. Examples of this include ranitidine, famotidine, and cimetidine. They all end in that dine, right? This medication will make you feel better when you eat or dine, right? Your ulcers feel better. So the medications are the uses. It's used for duodenal or gastric ulcers as well as GERD and Zolliger syndrome. And Zolliger syndrome causes increased secretion of gastric juices, right? Makes sense. The mode of action is to block H2 receptors in the stomach, which reduces gastric acid secretion. Side effects of this medication will be what? Since we are reducing this gastric acid, right, we'll have an increased risk of having what? Bacterial colonization in the stomach, as well as since it's in the stomach and it's a colony, it will start climbing up. Where will it go? Your esophagus, and if it goes to your esophagus, will end up in maybe your respiratory tract. And with cimetidine, we may take it without meals, and we need to avoid taking antacids before 1 hour before and 1 hour after administration of H2 receptor antagonists. PPI, proton pump inhibitors. So these medications end in prozol, P-R-O-P-R-A-Z-O-L, prozol. And some of them include what? Omeprazole, pantozole, as well as lansoprazole, which is Prevacin. Their uses is to treat what? Duodenal and gastric ulcers, GERD, and Zollinger-Ellison syndrome. And remember, we said Zollinger-Ellison syndrome increases the secretion of gastric juice. Its mode of action is to inhibit an enzyme needed for acid secretion. Side effects include GI upset. With long-term use, there's an increased risk of osteoporosis. With esomeprazole, we normally take it 60 minutes before the meal. We swallow the capsule, and it may be taken with other antacids. Mucosal protectant. When you talk about mucosal protectant, we are protecting what? Our mucosal covering. So, example is sulfate, and its use is primarily for duodenal ulcers. Mode of action: it reacts with your stomach acid to form a thick paste that adheres to the ulcers. So it covers it, right? Covers your ulcers. Side effects: since it's making a thick paste, constipation. So for this medication, we always administer this med 1 hour before meals because we are trying to cover those ulcers so we are not having pain when eating, and at bedtime. Since what? At bedtime, there is always increased secretion of gastric enzymes. So this medication is administered 4 times daily prior to each meal and prior to you going to bed. We always advise this patient to increase their intake in fluids and fiber to help with the constipation side effect. Antacids. We have various types of antacids, which are aluminum hydroxide, magnesium hydroxide, sodium bicarbonate, and calcium bicarbonate. So their uses are to treat peptic ulcer disease as well as GERD. Their mode of action is to neutralize the stomach acid. Side effects depend on which antacid we take. Some of them, their side effects is constipation, while others is diarrhea. So with aluminum and calcium antacid, we watch for constipation, and for magnesium, we watch for diarrhea. So always remember, we administer antacid 1 hour to 3 hours after meals and at bedtime, and 1 hour before other medications. So why are we giving it 1 to 3 hours after meals and at bedtime? It's because this is when we have increased secretion of gastric enzymes. Prostaglandins. So with prostaglandins, example, we have a misoprostol. So with misoprostol, we use this prostaglandin medication to prevent gastric ulcer in patients who are taking NSAIDs for a long time. We also use this medication to ripen the cervix of women who are getting ready to deliver. So what? Contraindication for prostaglandins is we do not give it to pregnant women. So prior to administering this medication, make sure you have a pregnancy test performed to females of bearing age. So mode of action, it decreases stomach secretion and it increases the production of protective mucus and bicarbonate in the body, right? So we decrease that stomach secretion and increase protection because of what? Our ulcers, we don't want it to be painful. Side effects include dysmenorrhea, miscarriage, and GI upset. Always remember to run a pregnancy test before administering this medication. Thank you for watching. Please like, share, and subscribe to my channel. See you on the next one. Bye.